My name is Dana Long. I'm a primary care pediatrician at UCSF Benioff Children's Hospital, Oakland. And I have the amazing fortune of being the co-founder and director of Bloom. Bloom stands for Black Love, Opportunity, and Outcome Improvement in Medicine. And it is the most magical place that I've ever worked as a professional. I've been practicing pediatrics now for 25 years as a primary care physician. So Bloom is the first in Oakland, and as far as we know, the first in the country, pediatric primary care clinic focusing on 0 to 3-year-olds with a racially concordant, meaning most all of our providers identify as Black, that is diverse across disciplines. That includes a mental health clinician, 3 providers, community health workers, doulas, lactation consultants, nutritionists, all working together to serve patients. We are trauma informed and an extremely dedicated group of individuals. The reason why we started Bloom is really it grew out of the pandemic and the racial reckoning that happened in 2020 with George Floyd that catalyzed a lot of the staff at Benioff Children's Hospital to think unapologetically around how we are accelerating racial health equity, understanding that within healthcare, we often have not been trustworthy. We often have not provided safe spaces for our Black families. When you look across the board, you will understand that the data shows that infant morbidity and mortality is highest for Black children and families across the board. We have higher rates of being born too early, too small, higher rates of maternal death during labor. And when you look at admission rates or hospitalizations or the leading causes of death across the United States, they are higher for Black people. Bloom is an intentional effort to love Black babies and families and improve health outcomes. Our clinic has 5 components. The first is that we provide racially concordant care. As I had described, we think about mental health as primary wellness, and so our mental health clinician checks in with all families. It's non-diagnostically driven. We carry historic and racial trauma. We carry the trauma of racism and social inequities, and we all need mental health wellness. The third component is that we have a doula working alongside us that provides help not only with human milk feeding, but also with baby bonding and nutrition going on into the toddler years. Working with a doula has been life-changing for me as a pediatrician. I have never in my 25 years of practice been within a primary care clinic and co-seeing patients with a doula. They provide so much safety and stability and knowledge and expertise for our families. The fourth component is that we actually address not only social drivers, but also the trauma that our families are experiencing. So we screen and respond to ACEs and unmet basic needs. And then the fifth component is around group visits, social networking. We have these fantastic group visit models where once a month we work with the Black Doula Network and Breast Friends, and we have breastfeeding lactation groups. We also are starting a group called Black Joyful Parenting. That is a capacity and skill building and social networking group that's going to be led by one of our providers and our mental health clinicians. Fundamentally, the purpose of Bloom is to accelerate health equity and improve health outcomes so that all of our Black babies know that they're exceptional.